All right, welcome everybody. We
Hello.
are going to talk a little bit today on Wellness Decoded, the top 5 ways to find your functional medicine provider. We know that a lot of people say they're functional, or people go to their regular doctor for these things, and regular doctors and providers are good for what they do, but they may not specialize in this area
Mhm.
or have additional training in this area.
Mhm.
So let's jump right in. We're going to jump to number 1 and check for functional medicine training and certification.
Right. So make sure your provider has formal education or certification in functional medicine. But look for affiliations with reputable providers so they can, be trained by another functional provider, which is absolutely amazing, who you trust. Obviously, those are like in it to win it, right? You're sitting there talking to them. You're actually seeing patients during their training. So
Hmm.
it's on the job training,
Right.
basically. That's wonderful. Then you've got people like Dr. Pam Smith, who's also a hormone guru, but she's great with functional medicine. A4M is a good company, continuing training with functional seminars and conventions. Those are great. So doing your training is great, making sure that they're doing some original training, but then continuing those education hours
Mm.
through seminars and conventions,
Right.
because those are going to be like the newest of the new things that are
Right.
happening in functional medicine. And that's what I like to do. Every year, I do about 4 different types of conventions or functional medicine, and I learn so much every single time.
Right. And a lot of these are backed by case studies. There's, Pam Smith, Dr. Pam Smith has done several, and some of these other companies and other providers have specifically done case studies in this area. So
Right.
there's proof in the pudding. It's not guru medicine. It's not like voodoo, not guru, but voodoo,
Guru, I know what
you
you meant
know?
to say.
Yeah. And so, and also, you put a little note here. Don't assume all holistic or integrative doctors are functionally trained. Ask about their specific
Yeah.
background.
Ask specifically for that background because it's your money, it's your life. So there is nothing wrong with asking what their training
Right.
is.
Yeah, because a lot of places, if you're going to be really in this kind of specific niche and need these type of services, most insurances won't cover a lot of what we do,
Yeah.
and so you're going to be paying out of pocket. And
Mhm.
so that hard-earned money, you definitely need to make sure you've got the right person. So,
Right.
all right, number 2, evaluate their clinical approach, root cause, not symptom base.
So, good functional provider will dig super deep into the underlying causes of the particular symptoms, whether it be health, toxin exposure, genetics, post COVID syndrome, all of that stuff. Also, use personalized treatment plans because you don't want a treatment plan that the person before you got, because that's not personalized.
Mm.
Yours could be completely different, but sometimes without having the time, lack of time can make some providers not want to do personalized treatment plans. We need a treatment plan individual because one size does not fit all.
Mm.
And then incorporate lifestyle factors. Make sure they're incorporating food, nutrition, sleep, stress management, movement, all of that stuff into their care model, because you don't want it to be, "Hey, let me give you this prescription and then you go ahead and sit on your couch and watch TV all day," because that is not going to help with your
Mhm.
functionality of your body.
Right. And you also mentioned down at the bottom of that, how to approach chronic or complex conditions. You want to touch on that?
Yeah, like autoimmunity or hormone imbalance, always ask them, because when you're looking for that provider, you might have these particular autoimmune issues. So make sure you ask, are you a specialist in this particular autoimmune? I will tell you straight out if I'm not. I will say, I am not comfortable with this. I want to send you here. In fact, I just sent 2 of my patients to someone else up in Salt Lake because I thought that that person would better serve them. And I love these patients, by the
Hmm.
way, and it was really hard for me to say goodbye. I'm sure I'll see them again for just regular stuff, hormone stuff, but this particular chronic condition that they have required somebody else that was more specialized.
Right. Yep.
Yeah.
Absolutely. All right. Number 3 is expect comprehensive lab testing and interpretation.
Yeah. So functional medicine relies on advanced or specialty labs. We do a lot of hormone panels and functional panels that are serum, but we can also do stool and sputum. But we our main panel is very comprehensive, but we always allow for room to change it into maybe micronutrient panels or toxin panels or stool, making sure that you don't have any ovum or parasites. Those are huge right now where people are noticing that actually we do have a lot of crud in our food that's developing parasites in our gut.
Yeah, we start out at about 40 plus biomarkers. Some of ours goes up to the 50 plus biomarkers,
Mhm.
depending on what level you decide on. And that is much. I just was talking to a patient today, and she was talking to her friend, and her friend went to another provider. They did like 10, 15 different things,
Mhm.
and she compared it to hers, and she's like, "Oh my gosh, your doctor, over at Optima, your provider." Does like 5 times, 10 times more than a normal provider did.
Mhm.
And so she's already going to be coming in and doing that,
Oh,
which
good.
is great. So that's the thing. We really dive deep,
Yeah.
and people just need to be educated on that a little bit more, just so
Mhm.
that they understand that there's so many things that can affect how you're feeling. If you're
Mhm.
losing weight, why can't I lose weight?
Yeah.
How, those type of things, and
Yeah.
all kinds of different ailments, really kind of those root causes,
Mhm.
like you said.
I'll be the first one to say if your situation requires someone with a different set of skills, I will make sure.
Yeah.
But it is so important to make sure that you use a different type of nuanced interpretation of labs. Allow your provider to stick with that, set of lab references that are on the labs, because that is not, it's a one size fit all again, right? We don't want that. We
Hmm.
want based off your symptoms and based off functional medicine rule, where do I want your TSH to be? Do I want it truly to be higher than 4.7 to be abnormal? No. My rule is 2. I want you 2 or less. And so if you look at the reference range, that's on most lab companies, it's 4.7 or higher.
Yeah.
Yeah. So that's just an example.
Right.
Everything else is really different. We don't treat with those normal ranges or nuanced ranges.
Yeah. Number 4, look for a collaborative and educational relationship.
So spend time listening. They need to listen to your history and goals, expect a long intake visits, help you understand your labs diagnosis and your healing journey. Encourage collaboration, not just top down instructions. Here, this is your instructions. See you in 6 months. No, we have a texting line. Our texting line is extremely important to me
Mm.
because I want those patients to be able to text me and I can get back to them pretty quickly. It just depends on if obviously, if it's Friday at 7 p.m., I'm not going to get back until Monday unless it's an emergency. Obviously, you can go to an ER or an urgent care for that. But please make sure you find a provider who collaborates consistently with you. I want to know. I sent a patient out today who, is going to start on her brand new hormone panel, never been on hormones in her life. Do you think that it's a good idea to send them out without knowing how they're feeling next week? So I make sure that they text me a week or two into it based off what we've
Yeah. Especially
decided
the
to do.
first 30 days is crucial
Yeah.
after your protocol has been
How are you
established.
feeling? Are you having
Right.
any symptoms? If you are, a lot of the times with symptoms, you can actually tweak based on symptoms and you don't have to do a full panel again.
Right.
But we still like to do the panel at the 3 month mark if you
Yeah.
started on hormones.
Right. And the big panel for us, we recommend, strongly recommend, our protocol is every 6 months you're getting that full 40, 50 plus biomarker.
Yeah.
And so, look for a provider that kind of gives that piece of direction,
Yep.
because it's super important. I was talking to a patient today, and you and I have talked about this, and I wasn't giving her any medical advice, but it was really about, we really want to know how you're doing on all of these things at least
Mhm.
every 6 months. And a lot of patients think, I do my blood work, I'm good. One
Yeah.
time, I'm done. This is going to be a lifelong journey for you.
Yeah.
If you really want to invest in your health and really optimize your hormones and feel better, then That's the commitment you
Yeah.
need to make.
Yeah. Even your vitamins and nutrients will change over 6 month period based on what you're eating,
Right.
based on the season. So if you're coming every year, it's not going to be accurate. You're going to feel cruddy during the times where you're deficient. So you need to be in at the 6 month mark to redraw at most functional providers.
All right. Number 5, the last one, accessibility and practice structure. What do you mean by that?
So functional providers may work in a private pay model, not always insurance based, which is what we do. They might have some nutritionists and some integrative teams that they have, like our medical assistants, and our nurses are amazing at educating on weight management protocols and functional protocols. And they don't ever give medical advice, but they have a protocol. And if a patient comes to them with certain conditions, they can go to the protocol and they can say, this is what Darlene says works for this. And of course, they always come to me first before that. But this is important to have those integrative, groups of people that can help with those issues. And then how communication works between visits, that's important, like our texting line, whether they offer virtual care, which we do. You always want to offer that because you don't want your patients who are not able to make it to say, well, I can't do this anymore. Throw up their hands and say, I'm done. No, you guys need to have the ability to find a functional provider that offers the virtual care as well.
Right.
And then what follow-up structure and support they offer. With our weight management, there's weekly check-ins.
Mm-hmm.
With our integrative and our functional, we do as much as you need, but we prefer that you come every 3 months for the first 6 months.
Right.
Yeah.
And with the virtual side, we can actually even send you out for labs and you don't have to mess with that laboratory, the big labs out there, even though our lab works in conjunction with these big labs. And we actually even have the ability to send a kit to you if you're in a very remote location, and we can send a kit. You can go to the local doctor that's there with you. They can pull your blood, put it all in the box, send it off. So you don't have to drive. So if you're way out in the boonies in the country, and you only have a family doctor that's out there that doesn't do this, you can actually send you kits. We really try to bring all of this to you and with all this flexibility, because if you just go to some places and you actually have to go in and go to a lab, and then you have to try to make appointments over there, do all these different things. We provide a lot of flexibility in a lot of different ways,
Right.
which is great. Okay, perfect. Anything else on this one?
Oh,
This one's an important
I
one.
think that with functional providers, your goal is just to find somebody that knows their stuff. So you can do some research on them. You can look at their reviews. Really, honestly, that might be one of the number one things. Looking at the reviews and seeing how happy their patients are with them. You'll know if it works by looking at that. If you don't have that and they're brand new, look at their background, look at their education, go talk to them, get a feel about how they are and how they're doing. There's more and more primary care physicians that do this. There's more and more direct patient care docs that do this, NPs that do this. So keep all that in mind. Don't expect everyone to do this because it is specialized for sure.
Yeah, for sure. Okay, perfect. All right. Well, that's the end of that one. Definitely love to have you like that video, share it with your friends and family, anybody specifically that's needing something like this. You really consider subscribing to our channel. We really try to just kind of give it to you in layman's terms and not try to talk over you, and just make it very accessible to everybody. And, hit that notification button on the channel as well once you subscribe, so that you can get notified when we do our next video. But yeah, that's it for us right now. Teddy's still sleeping, our little mascot here. But anyways, we will definitely see you on the next one. Love you.
Love you. Bye.